On its website and in promotional videos, there's no mistaking the pitch from PEIDoctor.com. If you're an international visitor, need a doctor, and have the money, there's no need to wait.
And we certainly don't want you to have to disrupt an expensive holiday.
Yes.
We want you to be able to get back to that.
The company offers same-day service, after hours and weekends at costs ranging from a couple $100 for a virtual visit to $900 or more for house calls. Dr. Janine Karpakis is a family doctor. She says these consultations occur outside her regular duties with Health P.E.I.
We can go to them wherever they're staying in the bed and breakfast or the hotel. It really is about not having to wait in urgent care or ER. It's convenience.
International visitors aren't covered under the Canada Health Act. The PEI Department of Health told CBC physicians and nurse practitioners can provide health care to individuals who are not eligible for Medicare, with those patients responsible for the cost, whether accessed through a Health PEI facility or otherwise by way of private agreement. PEIDoctor.com is also offering a private service to Canadians. For $195, you can spend 45 minutes with a doctor, which the company says is to provide context and information after you've received a diagnosis or test results from your doctor or the ER.
And because the healthcare system is so strained, you can't really get back to see that provider in a time period or sometimes never. So that's why I'm saying this consultation is inviting you to come sit next to me as if we're talking in my living room.
But a group advocating for public health care says it doesn't believe private clinics can charge Canadians for these services.
The description of that service sounds like it's medically necessary health care, that it's, that it's part of the intake. For us, that would be considered a violation of the Canada Health Act and something that our provinces and the federal government should take action on.
We're asking a simple question. Are there services that are outside of the scope that are permissible for private pay? And the answer is either no, or perhaps yes. And we believe there are, and we believe there's a need.
In follow-up emails, the company said PEI Doctor does not offer PEI Medicare-insured physician services to insured islanders on a private pay basis, and said it supports and respects PEI's publicly funded healthcare system. PEI Doctor says there is a role for private for-pay healthcare to support the public system in PEI. It's a familiar argument, and so is the counter-argument from the Canadian Health Coalition that private healthcare bleeds the public system of staff and resources, leading to longer wait times for those who can't afford to pay. Kerry Campbell, CBC News, Charlottetown.